Starting your IVF journey brings a lot of emotions. You wouldn't be alone in feeling excited, scared, or anxious, and you'll probably have a few questions. So we'll start with a big one. What happens in the IVF lab? Before your treatment starts, you'll meet the team that will help you on your journey through IVF. An embryologist is part of this team. They work in the IVF lab and care for your eggs, sperm, and embryos. After egg collection, your embryologist will take your eggs to the lab to count them. Your eggs are then put into a special dish and an incubator to keep them warm. This is to mimic the inside of your body. Here's where the sperm comes in. On the same day as egg collection, we get the sperm ready for insemination. Insemination is when sperm is added to your eggs. The sperm is washed to take out all the dead and abnormal looking sperm, so we are left with the strongest swimmers. This takes up to an hour to do. Your embryologist will talk to you about how your sperm has washed up on the day. The next step is fertilization. This is where sperm and egg join together to make what will become your embryo. Sometimes, however, the sperm need a little bit of help because they are not strong enough to fertilize eggs by themselves. One other method we use for insemination is called IntraCytoplasmic sperm injection, or to you and me, ICSI. In ICSI, the embryologist picks a single sperm and injects it inside the egg. Your embryologist will let you know if ICSI is best for you. The next morning, your embryologist will check the eggs and phone you to let you know how many of your eggs have fertilized. We expect 60 to 80% of eggs to fertilize normally. This is where it starts to get exciting. The fertilized egg then starts dividing, and by day 3, it already has around 8 cells. On the 3rd day, your embryos are graded, and your embryologist will phone you to let you know how they are doing. If there is a single embryo that clearly stands out as better than the others, we recommend the embryo is transferred that day. However, if your embryos all look similar and it's difficult to select the best one, we recommend leaving the embryo to develop until day 5. By day 5, about 30 to 40% of embryos will reach blastocyst stage. This is the stage just before an embryo would naturally implant into the womb. A blastocyst is made up of an inner group of cells with an outer layer. The inner group of cells becomes the fetus, and eventually the baby itself. The outer layer protects and nourishes the fetus and will form the baby's placenta and sac. When it's time to transfer an embryo, your embryologist will choose the one with the most potential. The chosen embryo is bathed in embryo glue. It's not actually glue, but acts like glue to help the embryo stick to the lining of your womb. Your embryologist will then load the embryo into a small tube known as a catheter. Then your doctor will place it carefully through your cervix into your womb. You will have a blood test to find out if you were pregnant 11 to 13 days later. After the embryo transfer, around 50 to 60% of patients will have leftover blastocysts we can freeze for next time. The quality of blastocysts stays the same once they are frozen and stored. Nearly all blastocysts survive when we warm them again at a later date. While you go through your treatment cycle, our knowledgeable and friendly embryologists are here to answer any of your questions about your embryos. All of this will be discussed with you in detail at the clinic. If you would like to speak to one of our fertility specialists to discuss if IVF is the right option for you, please email us at fertplus@adhb.govt.nz.